all bringing all your wisdom, and I will continue talking about vibrations and where science meets wisdom. Just see if I can. Okay. So, as you already said, my name is Stine Ruge, and I'm representing the International Forum for Promoting Homeopathy, which is um, a big community of hundreds of homeopathic doctors. Um, it was made in south of India during the first Corona lockdown. And the whole idea was to bring wisdom to colleagues. So every single day, we started a lecturing, a session, bringing wisdom to each other in English and in Hindi and in one of the local Indian languages. And it's been going on every single day, no break, for more than 5 years now. So it's quite cool. And I'm managing the Scandinavian department. Except from that, as you already probably know, I am a homeopathic physician. I'm trained at the Center of Homeopathic Education in London, and I have been practicing homeopathy the last 10 years. Before that, I have a background in Chinese chiropractic and um, disease prevention through herbalism and homeopathy. I run a full-time global clinic, and once a week I work remotely in a general practice in Gambia where I prescribe only homeopathics. So everyone will come in to see what you usually would see your doctor about, but you will only get homeopathy for me, and it's working great. Now I am specialized in obstetrics and gynecology, and I have been participating in births for more than 10 years now. So, as an obstetrician, gynecologist, homeopath, what I do is I go to birth settings and I prescribe acutely. So I prescribe obviously according to the homeopathic principles, but for acute situations. So that could be like a retained placenta or uterine dystocia, um, pain management, stuff like that, hemorrhage. During pregnancy, I work with chronic diseases, what we call miasms in homeopathy, and that is to predict um, what we might meet during the birth. So instead of saying, okay, this woman is like this, she must be put into this category, be put on this medication, we look into what is her genetic dispositions, what is her symptoms, mental, emotional, physical, and then we treat her in order to prevent birth acutes. Then I take care of women who has been going through traumatic birth and the infants as well. I teach and I supervise at different homeopathic colleges and at a few doula courses. A doula is a birth helper, if someone doesn't know that. And as soon as my clinic got very busy, I wanted to help people treat themselves. So I got the idea to start an online community for mothers who was wanting more than paracetamols and who could. I wanted to create a safe space where you could talk about. So my doctor said this. What are the alternatives? What can I do? If you want to ask about vaccines, for example, you're completely open to do that. Um, and the day I opened the online group, 200 women signed up. So there was definitely a need for it. I was calculating with 12 members, but we have been 200 members the last 2 years, and they are all being taught how to treat themselves and their children. So that's just amazing. They are sharing like-minded uh, ideas of the world and thoughts, and it's just a place where women can meet each other um, outside of the conventional system. But what I want to talk about today is that all over the Western world right now, there we have this drama going on in maternal care where lots of women are losing trust in the system. Lots of women are going forward and talking about birth trauma, obstetrical violence. Um, a lot of women choose not to give birth within the system. We see a rise in home birth, we see a rise in free birthing, and I think that this movement within the last few years has been triggered from the Me Too movement, um, that women are finally talking loudly about how they are experiencing this. I know from myself, I have 2 children, that I felt like a woman who could set boundaries and take a choice in whatever I wanted to do. But as soon as I got pregnant, I had to follow some rules. And if I didn't, then there was a lot of fear mongering, wolf crying, and it was like, your child is our patient more than you are. And that's quite traumatic to experience. So, and it seems like I'm definitely not the only one. Um, I have linked to a Science Direct article, which is a collection of 8 different studies which has been made in the Western world last year. We have USA, Australia, Great Britain, Canada, and Holland. I find it very interesting that Holland is actually participating here because they have a long tradition of home birthing and midwifery. So we all feel like they are kind of the goal. But a lot of women there are also experiencing what everyone else in all the other countries are saying. They are not being listened to, they're not being respected, they feel like their boundaries are being crossed all the time, they lack autonomy. And unfortunately, that means that a lot of women, in comparison to a few years ago, are not wanting medical checkups. They don't want ultrasound scans. They don't want routinely prescribed medication, which you can understand because it's not individualized treatment, and obviously they often meet a scene where they need to talk to a new doctor every time they show up. They meet a new midwife every time. They don't know the people who are going to participate in their birth. And when you feel like during pregnancy that you are not able to take responsibility for your own choices because you're told what to do. Then going into a room full of strangers with routine protocols and medication is quite scary. Um, so that's one of the reasons why we see a huge rise in this. And these women, like, why would they reject modern medicine? It's uh, it's supposed to be really, really bad if you do that, and that is exactly what it is. So they do want help if they need it. They do want medication if they need it, but they can't see themselves in the system anymore. So what do these women do? Well, first of all, they seek like-minded communities, often online. And then secondly, they find holistic practitioners. I chose to specialize in obstetrics and midwifery because I was um, I was going from a general practice to suddenly having 80% of all my patients with birth trauma or with postpartum issues that no one would do anything about. They felt like every time they were going to see their doctor, they were just being rejected, told, oh, don't think about that. Every time they asked about side effects of a medication, the person who was trying to give them some information didn't really know anything about the medication, even though it was doctors or midwives. So it was very, very difficult. Well, it is very difficult to take an informed choice when you don't really know what's going on, and the people who are hired to help you doesn't really know what's going on either. And this is a growing community. I see more and more women coming to me. Homeopathy is not very big in Denmark, but neither is herbalism or Ayurveda or anything else. So they go to the people that they hear from other women are doing at least something for them. And what we do in homeopathy is we follow a few principles when taking the case and um, analyzing the case, prescribing, and so on. We obviously have a few more principles than these, but we have the like cures like, which in homeopathy is we look at all the symptoms of the patient, or the physical or the mental emotional symptoms, and then we match it with some kind of homeopathic remedy which has all these symptoms. So um, in obstetrics, how could we how could we take this on to, like, how could we use this philosophy? Well, we could meet people where they are. We could listen to the story of the woman. We could treat the patient, not the disease. Then we have restoration of the vital force, which is really restoring homeostasis. We don't want any patient to be addicted to a therapist or a certain type of medication. We want her to be able to stand strong, and we want her body, her vital force, which has many names, prana, chi. Um, I heard another name for it in the talk about uh, longevity yesterday. It's all about how to restore this way the body can heal itself. But it's also about how the woman should heal herself in a way of taking informed decision, taking intuitively decisions, because childbirth isn't really a science. You know, it's nice to know what to expect, but you can give birth no matter how many courses you participate in. And then we have the minimum dose, which is about the same principle, really. We don't want the body to overreact. We don't want it to get dependent on something. And and here we could say, okay, so we don't want protocols saying you are a pregnant woman over 40. So we want you to do these things. No, we take a look at this woman and look at her health, her history, what is going on with her, what does she need? We don't prescribe just for convenience. We see a lot of that in maternity care, where um, we start labor because it's convenient, because of the time of the day or how many people are at work in the hospital. We do many medical things for no really good reason. So we really need to think about that, because that is actually scaring people away. And these free birthers that are rejecting the whole system's way of treating pregnant and women in labor, these women are not naive romantics or uh, big ego women who doesn't care about the health of their child. They are doing this because they really care about their own health and their child's health. And we look at them a lot, well, media wise. We view them as tinfoil hats and uh, women who are not very intelligent. But I host I host a podcast together with a midwife where we talk about natural medicine and anything regarding pregnancy and childbirth. And we have been deep diving into free birthing the last year, and we have not met any naive woman who doesn't know what she's doing. A lot of the women are highly, highly educated. Some of them are researchers, they have PhDs, some of them they are used to looking into studies, they're used to going home and thinking, okay, so the doctor said there was this choice, but obviously that can't be the only choice. And then they look in and compare what do they do in different countries, and it's very, very well prepared women. Um, yeah. So I have some case examples from how we do it in homeopathy. So one was a 30-year-old lady. She was expecting child number 6. She was labeled high risk due to previous large postpartum hemorrhage, but being close to 40 years old and expecting child number more than 4 is actually also a high risk category. So she was quite high risk in the system's way of viewing things. She was recommended labor induction and epidural due to heavy pelvic pain. She was experiencing repetitive nightmare and fear of birth. So she came to me, and I really just sat down and took time to understand her situation. I found out that she had been doing everything for her hip pain, like yoga and uh, pain medication that was prescribed for her, and it didn't work at all. So, what we figured out was that she had been experiencing birth trauma, obstetric violence. She had also been in a violent relationship, and it was all kind of clotted down in her hip area. So if you look at it holistically, you would say, okay, that makes a lot of sense to the root chakra issues. So I treated her with remedies for different kinds of trauma. Um, we went very, very high in potencies because it was a grief. It was a suppression that she had been carrying for a very, very long time. And as soon as she was prescribed this, her pelvic pain disappeared. She was still experiencing nightmares, fears of birth, but obviously she was going back to the same place that had been giving her traumas, among others. So, so we took a long talk and talked pros and cons, and decided that she should home birth. I have been working a lot with an obstetrician in India, and if I should just make a comparison to like two different extremes, imagine like Indian traffic, completely insane to go through in rush hour. But in Denmark, you can call an ambulance and they can be at your house within 5 minutes, and then you're off to a hospital. And we're a very small country. The hospitals are very nearby everyone. So giving birth, if an emergency should happen at home, it's very safe here. So so she planned a home birth, and there was going to be two midwives attending because she was a high risk category. But I arrived very early, and as soon as I saw small symptoms of fear, adrenaline appear, I treated that in according to all the emotional trauma she had in her hips, which made her adrenaline decrease. And when the adrenaline decreases, the oxytocin will increase. And when oxytocin is high during childbirth, your body can prevent a bleeding. So high oxytocin makes the homeostasis. So suddenly she was having an amazing birth at home, no big bleeding or anything, because the bleeding was probably caused by high adrenaline due to the trauma in the last birth. Um, Another case that I picked out, I actually just heard from them 2 days ago, so I didn't know that it went so well. That's why it was new in my memory. I wanted to take this. It was a 6 days old baby boy that I treated last summer, I think it was. So mother and baby was two different blood types, and because of that, the mother was inducted at 38 weeks. And when you start inducing, you will start an cascade of medical interventions. So she kind of got everything there is on the board in Denmark, where we have tax-paid healthcare. We will call it the whole tax gift. She got everything, and so did her boy. So because of this blood type issues, the baby was born with heavy jaundice, and the red blood cells were starting to break down. It was quite critically. When I talked to the mother, she was phoning me from a hospital in the other end of the country. She was crying nonstop through the entire consultation. She described her baby as mild, communicative, breastfeeding well, all great symptoms. We knew that the vital force was quite high due to that. The baby was scheduled for blood transfusion, and she had no idea what to do. Um, so as many of the women who I see in my practice, she had never ever thought about talking to a homeopath. She didn't even know what homeopathy was, but she just had a craving that someone would listen to her because she didn't have that luxury in the hospital. Um, I just looked up her case, and I can see that I prescribed a remedy for her which was minded on her nervous system. And then I prescribed three different organ remedies, low potency for the kit, to increase the energy in the liver. And then I talked to her, listened to her, encouraged to skin contact. And as soon as they started the remedies, the blood cell count began rising. And within 5 days, he was completely stabilized. Blood transfusion was cancelled. The family could leave the hospital. And according to her, the medical team was shocked. They had no idea what was going on. Um, I love homeopathy. I think it's extremely effectful. I have no need to prove how effectful it is because everyone who works in individualized holistic medicine knows how effective those kind of medicine is. But I was thinking, so she was being treated for her nervous system. They were doing skin to skin. Sure, I was stimulating the child's liver, but I think that just talking to someone who takes time to listen and to look at her and her baby as individuals did most of the treatment. So I was thinking, what could the conventional health system in maternity care look like in the future if we incorporated the principles of holistic medicine? And when we work as holistic doctors, we have the privilege not just to see the medical world from outside, but we spend every single workday talking to citizens who want something else. So to me, it's not about there is this system. Do we want to integrate? Do we want to make our own? It's more like there are a lot of people who want something else. Women are refusing medical care during childbirth. It's really wrong what's going on. So what do they get when they go to us? It's really, really simple, isn't it? We listen, we make them tell their story, we treat them as humans who have rights to say yes and no. We talk to them about pros and cons, and we meet them where they are. So that would probably be argued with that meaning we would need to hire a lot more people. We would need to be seeing patients for a lot longer time, not just the 6 minutes that you do in general practice. Yes, that is true, and it does sound expensive, but what if we could have actually a better financial outcome? Because that would decrease the need for medication. If we decrease the need for all the medication we use in childbirth, we could actually grow more healthier human beings. There would be less trauma, mentally, physically. We wouldn't start an intervention which would lead to a lot more medication, a lot more, synthesizing for the labor, epidural, everything you can get. That it is extremely expensive. And we know that if you have started just one medical intervention, the chances of ending in an acute cesarean is suddenly increased by 40%. A cesarean is very, very expensive to the system, and so is the postpartum time afterwards. We have babies who are born with less of the good bacteria. I have so many infants in my clinic born by cesareans who have so many issues with allergy, colic, reflux, hay fever issues, ear issues, all those because they have been born into suppressing medicine. So when we look at it from our point of view, it would really save a lot of money, a lot of time, and we would become healthier. And isn't that really what it's all about? I would say. No matter if we are practicing homeopathy or allopathy or Ayurveda or what else, we want a healthier, better world, don't we? So, on behalf of all women, thank you for listening. And of course, you're very welcome to reach out if you have questions or want to collaborate or anything or what you can think of. So thank you, everyone.